Good afternoon, everybody. Thank you for being here today, once again, on one of the episodes of Talaskills podcast. For today, as guest, we will have Rob Pegram, which is a biotech leader with 20 years experience, and he's now the founder and CEO of Neuropath Bioscience, a Cambridge-based company developing the world's first biochemical diagnostic for emotional distress. So Neuropath will combine digital psychometric data with blood-based metabolomic analysis to integrate through AI and generate an objective risk score that helps clinicians identify emotional distress early and intervene before crisis. Rob, good afternoon.
Good afternoon, and thank you very much for inviting me along to the podcast. I'm really excited to be here.
My pleasure to have you on the podcast today. Let's just dive in straight to the topic. But let's start with a little bit of an introduction on your end. You're a leader in the industry. You've worked 20 years plus. Can you tell us a little bit about your experience so far in evolution in life science?
Yeah, sure. And as you just mentioned, so I've worked for the last 2 decades in biological sciences. And I've seen a lot of sort of changes in the way that we've been dealing with data and biological discovery, and just thinking specifically around about sort of AI. Just treating that right now is what we're seeing is simply like the next step, really, in a 20-year trend. It's turning a lot of biological discovery into digital understanding, and going back through all of my 2 decades in biotech and diagnostics. I've led a lot of scientific teams, developed a lot of platforms, turning complex biology into practical tools for healthcare. And when I started, sort of diagnostics was largely a very analog, manual, reactive process, very focused on confirming what had gone wrong. And the real revolution, I think, sort of came along just before AI, and it was the digitization, I think, of biology, when we were getting automation, high throughput screening was coming in. There were more cloud-based data transfer, data was coming in and really transforming labs into big automation and information engines that they are now. And that big shift has really brought diagnostics closer to the patient through the creation of more portable instruments, wearable technologies, home testing, creating continuous connected data. And once the biology became digital, the next question was inevitable, really, is how do we make sense of all of this information? So I'm thinking that in many ways, AI isn't a revolution. It's just a natural next step. The groundwork was already laid when we started turning biological noise into more structured, analyzable data, and it's a really exciting time.
Excellent, excellent. So you've been through the life science and seen a couple of change and innovation as well, which is great. AI being one of the latest. We will jump into the AI topic later on, but can you maybe tell us a bit more on how is Neuropath Bioscience using AI to change the way we diagnose and understand emotional distress?
Yeah, no, of course, and thanks for coming to that. But we're not teaching AI as such to diagnose people. We're teaching it to listen to the biology, because from our understanding and speaking with potential customers and patients, there's the invisible problem, which is the emotional distress. And that largely leaves almost no trace in standard medical tests, because the tests these days mostly look for disease, not dysregulation. And in the environment of emotional distress, a young person can appear perfectly healthy from routine panels and even while experiencing significant psychological strain. And that invisibility mostly means that the distress can go unnoticed until they get to that sort of crisis point. Perhaps along the pathway, parents may sense something's wrong with the child in terms of their communication or with their general behavior, but there's no objective data yet to really sort of confirm and identify this. And this is where Neuropath's approach is coming in. So as you already mentioned in the introduction there, we're developing the world's first biochemical diagnostic for emotional distress. And this is combining a simple dried blood spot sample from which we're going to detect subtle metabolic fingerprints using biochemical shifts associated with stress and emotional dysregulation. And in parallel, combining that with data from psychometric surveys, which are based on well-known clinical frameworks. The AI model in this instance is coming in from integrating the biochemical and the psychometric data sets together and using the AI to really expose and investigate more deeply the correlations between how the body and the mind respond to these external stimuli and what the individual's going through. The output of this sort of correlation of the data sets really is going to be a biopsychometric risk score, an early warning signal as such, which really quantifies that emotional dysregulation. And the idea of that is to provide clinicians with a more objective, data-driven insight to support earlier and more accurate decisions. It validates really what the parents and the professionals sense, but they can't quite measure. And it's really bridging that gap between biological science and emotional health. So from what we see is that the broader impact really enables earlier identification, more personalized intervention, and better outcomes. It's moving mental health diagnostics from a subjective conversation to becoming more data-informed medicine, and it's positioning AI not as a replacement for a technician, but more as a translator tool between biology and the behavior.
Okay. This is great. And then I will jump into another thing, because you talk about neuroscience, you talk about body and mind. I try to understand also, how are we sure that is going to be able to analyze or point it out that there is a risk of emotional distress, or is emotional distress something that build up, or it's something that can also come suddenly?
That's a really great question. And one thing we're really kicking the can around with at Neuropath at the moment is to how early on we could potentially identify these traits. Is it something genetically inherited, and are these metabolic changes detectable earlier on in life? One consideration, one thought we've been having is around some newborn heel prick tests. You can screen at a very early age for different metabolic disorders very early on in infancy. If you were to screen those newborns for the different biomarkers we're looking for in the case of emotional distress, would you be able to detect a signal very early on in life? And how would this, and this is just hypothetical, it's just some sort of ideas we've been kicking around, but would you be able to screen much earlier on in life for biomarkers which could predict or have some sort of predictive power towards emotional distress or other types of neurological disorders? And there'd be a big ethical conversation, I guess, really around how you then nurture and treat that individual going through different stages of life if you know these things about them at a very, very early age. And with mental health at the moment, it's still delicate as to how we'd really go and answer that question. And through more screenings that we're going to be doing, and really going into further validation of the biomarkers and developing the science and the technology platform here, we'd hopefully be able to answer that question in much more detail, but still going through those sort of early proof of concept stages and phases. It's letting the data do the storytelling at the moment. It's where's it going to lead us? We still need to really have better understanding of exactly what we can do with the technology through this screening platform.
Okay, this is great. Thank you for the clarification. And one other clarification, obviously we talk about emotional distress. Probably people will understand, but can you give us maybe 2-3 examples of what we can call emotional distress?
Yeah, and from lived-in experience, this is why I started making where Neuropath came from, really, is through the lived-in experience of many. Unfortunately, a lot of people I know are parents, and their children have been going through different life events, through school, through adolescence, things they're seeing on social media, and for whatever reason, unfortunately, the parents are noticing, as I've already mentioned, some low mood in the kids and in the individuals, and unfortunately, it's leading them to start self-harming and hurting themselves in response to these different factors which are coming into their lives. And the parents can sometimes notice that there's a bit of a change in their behavior, but they're frustrated and don't know how to how to help or how to guide their kids. Basically, they can see that something's not quite right, but there's no way of really sort of reaching out to them and finding out precisely what's going on. So by having this bridge over between a psychological survey and doing the blood tests with our validated biomarker panels, this is where we could hopefully offer some more support and try and alleviate that anxiety that the parents are seeing, so they can help their child, and also to try and get to the child or the individual to offer them the right kind of support and management of the way that they're feeling, and to try and help them work through this area of anxiety, of depression, if we can see that they are really at risk.
Okay, great. So I guess a broken heart can also be can also create an emotional distress as much as maybe a burnout.
Yes, most definitely. And again, since COVID as well, we've been seeing a much larger increase in these types of cases coming through as well. Largely, I think, in the advent of extra use of social media. There've been some great books sort of written out there already, which are very much sort of pointing in this sort of direction. And in some of those case studies too, I can't remember the precise book title myself at the moment off the top of my head, but there was a case study whereby, some parents had taken away their daughter's mobile phone for a couple of weeks, so she didn't have access to Instagram and to Snapchat, and they could see the sort of dark moves and the dark persona that she was starting to show, and this more troubled state that she was being in seemed to go away. And then, to paraphrase, they had their daughter back. And I think there's a lot of stress and external pressures being put onto young people these days, largely through the advent of social media and having a lot of FOMO, trying to live up to unreal expectations through airbrushing, through filters which are coming onto mobile phone apps. And it's playing into their lives. They're constantly striving, I think, to try and reach this ideal expectation, which is unreachable, it's impractical, and it's really negatively impacting them, as well as potentially different communication methods which are happening with small pockets of friends and alienation, which can be going towards cyberbullying. It's all having this knock-on effect to the adolescent at this sort of time, and I think that's a real big driver towards what we've been seeing since COVID.
I see. Well, hopefully that what you bring on the table will be one of the solution to the problem. I have another question for you, Rob. What do you see as the biggest opportunity or challenge for AI in healthcare and diagnostic these days?
So I think AI's real power is going to be the amplification of human insight, and not being the automation of it. So the opportunity here is to create a new paradigm whereby when AI is going to enable medicines to move from reactive to being predictive and preventative, and it's spotting risk before greater symptoms appear. We can turn health data into foresight rather than hindsight. So rather than fixing something when it's been a problem, we can sort of see it on the horizon and then steer the individual away from that. And from the basis of our platform, it's about using multimodal data as well as the next sort of diagnostic frontier. I think the future lies in connecting biological, behavioral, and digital signals, and the AI again is just going to become the interpreter and bringing all these diverse inputs together into one coherent picture of health. So I see the AI as augmenting clinicians, not at all replacing them, but it can expand what the clinicians can see and help them understand more from complex data sets. We've talked about the correlations between biomarker overexpressions and the different responses from the psychological surveys to give an individual and personalized report and profile of an individual, which can be done instantaneously with a machine learning platform, which is going to sit behind the Neuropath diagnostic. So that's going to speed things up immeasurably. Of course, there are going to be some challenges there. So, for example, sort of data and bias and transparency with AI and machine learning specifically, its output is only ever going to be as good as the data that it learns from. So any biased data sets coming in is going to lead to some biased care. So the models have got to be trained on clean data that's been well passed, and it should also be explainable as well, so that clinicians know how to trust the conclusions which are being reached from the platform. So they're not just using a device; they understand how it's working in the background to support the work that they're doing and help them help the patient more effectively and more quickly.
Okay. Okay, great. And so just to jump from there to another point, NHS, for example, do you think it will help release pressure there?
Yes, most definitely, and I really hope it will as well. And as I've already said, that I don't think AI is going to replace doctors, but I'm hoping that doctors that use AI will be able to outperform those who don't. So, from some of the use case conversations we've been having, one of the real pressures on the NHS right now is the sheer volume of appointments that GPs are having, which are all related to stress, anxiety, emotional symptoms, and these are taking up around about a third of all GP visits. So many of these, from what I've been hearing, become repeat appointments, largely because clinicians, not because the clinicians aren't good at doing the job, but there's no objective data to guide them to the next step. And I think this is really where the AI supported diagnostics can make a real genuine difference. So if we can provide a biochemical signal of distress that something is measurable, or this can really play into the clinicians as they're suddenly going to have something tangible to act on. So when that's combined with psychometric data, the AI can really help interpret the complexity and bring to the surface any early risk patterns that might otherwise go unnoticed in the individuals. And the impact on the workflow could also be really significant. So instead of, you go to the GP and then they'll sort of come back in 2 weeks' time, let's see how you're doing. With this diagnostic sitting behind it, the clinicians can act more decisively at the first presentation, either offering the right type of reassurance or escalating the patient for faster support to the designated clinic. And I think that alone should help reduce the revolving door problem with some consultations, which should shorten referral times as well. So I think really at the system level, it could mean fewer unnecessary tests. It could be point towards better use of clinical time and more improved resource allocation. And the real story isn't just going to be about efficiency. More importantly, it should be about care and the quality of care. And when that data validates what a patient's feeling, the patient's going to feel heard, and that's so powerful in itself. And I think that's really how AI can quietly make the NHS more human and not less human.
I see. I see. But this is also a very good analysis and deep as well, because that makes me think of maybe a formula where the contribution of AI can actually bring new type of specialist instead of NHS to basically support those people with this kind of symptoms, emotional distress. Maybe it cannot only be led to NHS to deal with it, but maybe we can have other experts who can actually, with the diagnostics made, with the support of AI, deal with this type of patient.
Yeah, that's a really interesting thought as well, one which I hadn't considered, but I think going along those routes, it's quite right. This is the start of a new way of thinking, a new way of working, and with the right integration into the system, it's certainly a new triage system which can have a massive impact at releasing a lot of that pressure and of the bottleneck of the GP's time. And certainly be very interesting to see how this can play out. It's a very new concept at the moment still, and working this into the NHS, which is, as a huge beast in itself. The buy-in and the uptake is a slow process, but it's identifying and first of all where those bottlenecks lie, and really exemplifying, as we've just been discussing, how this can have such a massive impact both to the patient and for the clinician's time as well, and really open up the doors and expand some bandwidth here. I think that's where the immense value is going to sit as well. So it's a really interesting point. I'm glad you brought that up.
Glad to I'm in the conversation with you, so I'm very focused to all the input you bring, and then I'm just trying to jump on those with some of my thoughts. But so with Neuropath, obviously the idea is clear. The diagnostics is to help to deal with patients who will have emotional distress, trying to anticipate worst case scenario with what can it to where it can lead to, where those emotional distress can lead to. So, what's the best case scenario for you? How do you see neuropath land with the work being put in motion now?
Great question. So what we're doing at the moment is to first of all, try and identify the individuals who are most at risk from the emotional distress. And again, going back to what was driving me to start the organization was the frustration from the parents of the individuals who are self-harming, that there's no way of really identifying or diagnosing, a kind of crude way of putting it, but identifying the patients and the individuals who are most at risk. Once and certainly there's not very much in terms of real hard sort of treatment that could be used to sort of help them. There's CBT out there at the moment, but the long-term goal for Neuropath, to answer your question, before I go too far off the reservation here, is to first use this diagnostic to identify the people who are most at risk. It's going to validate the biomarkers which we're looking at, and we're screening a panel of these, and each one aligns to a different neurological pathway, be it with oxidative stress, with addictive behaviors. And once we've got expanded our data sets on this, we'll have a more clear idea of how each neurological pathway ties in with the individuals who are at risk, and also with the psychometric score is really going to help us drill down into the specific patterns and correlations which we're seeing in the individuals. The long-term goal from that information is to then look at those pathways and then start making some more efficacious medicines towards this, because there's very little treatment or therapy out there and available for people who are going through these episodes who may require some treatment. Oftentimes they're being sort of grouped under the anxiety or the depression umbrella, and that shouldn't really be a capture all. It's very in the mental health space. There's a huge, great big grey area, but it's how do we first of all find these individuals who are kind of lost in that noise before we can treat them. We need to find out who they are, and that's where I see Neuropath going once we've got the diagnostic up and working, is to then try and unlock the opportunities to start making some good medicines here.
So it's medicinal care, basically.
That's the long-term goal, yes. Again, when I was starting the organization, I wanted to try and help my friends to plug them into any types of care, any medication that would be maybe available to help with their children who are going through these episodes. And to my dismay, that there was nothing. I started going down a rabbit hole, couldn't find any treatments or any therapies out there, and that's in itself led me to then think, well, okay, how if there's no medicines here, who are we even trying to diagnose? And from all the literature that I've been reading, there was absolutely no diagnostic out there which was sort of trying to identify these individuals by themselves. And actually, that's a nice segue, because I'm writing a systematic review at the moment with one of my partners, and we've screened over 10,000 papers at the moment to go through this review. It's a backwards look over the last 15 years of all literature in the NSSI space and emotional dysregulation space, and it's amazing how many papers have been written, but none of them go down the route of investigating any sort of diagnostic options or opportunities, ways of identifying these individuals, let alone any therapies or ways of treating and alleviating these types of behaviors. A lot of papers will talk about these groups of people, but there's, again, no way of identifying them before they've started hurting, and they're going down the sort of self-harm route. So that, to me, is really important, and again, it really adds a lot of gravitas to the work that we're doing, and the importance, because it's a huge unmet area at the moment of all these sort of voices suffering in silence at the moment.
Okay, great. Yeah, very clear, very deep. There's a lot to do, a lot of work to be done. And then so, the world that we know is obviously changing. The world with worker is definitely evolving. How do you see the future? Do you see it brighter or darker with the the input of the addition of AI in our day-to-day work?
That's a really good question, and I guess if you're looking at it from a sci-fi perspective, we've all seen the movie Terminator, right? So
Yes.
there's obvious connotations which come with that and with Skynet. But I think from a therapeutics perspective, the future is bright, and it's certainly optimistically bright anyway. If we can design the technology to serve humanity and not have it the other way around, as Sarah Connor found out. So I'd like to describe my look really as being cautiously bright, and I certainly think the future looks very promising, but only if we ensure that the technology continues to evolve in alignment with human values, with what we want. And the aim should never be for technology to replace people, but instead it should be there to support and extend what makes us uniquely human, to allow more empathy, creativity, and our ability to connect with each other and with patients. And I think really AI will certainly automate a lot of repetitive tasks, and that certainly shouldn't be viewed as being a threat. It's really about redefining work and not about replacing workers. So in healthcare, for example, I think AI could take over a lot of the administrative burden and the data-heavy processes which can consume so much time, freeing clinicians to focus on what truly matters, and that's being present for the patients. So the real challenge, I think, isn't going to be in adaptation. I think the question isn't will AI replace us, but more how do we adapt so that humans and machines complement each other. In medtech, the human element will always be irreplaceable, and technology should really amplify care, not distance it. So that could sort of be called digital empathy, I suppose. And for me, I think that's why the future really is bright. And if we use AI wisely, then healthcare won't become more mechanical. I think it's going to go the other way and become more human.
Great, great, great. Thank you for your answer. Thank you for your opinion and position on the topic. So Rob, I think we come to the end of this episode. It was a pleasure to have you today and then to hear more about Neuropath and the work that you do, combining AI and all the other tools to make it work for people having emotional distress, and then trying to help and make a difference in that field, which I believe is a bit niche because it was the first time I was hearing about finding a solution for anticipating the worst case scenario for people having this type of distress. So thank you a lot for your input today.
Thank you for having me. I really appreciate it.
All right, thank you. And it was another episode of Tala Skills Podcast today. Thank you for taking the time to listen. I see you at the next episode. Bye-bye.